Hey, what's going on, guys, and welcome back to the next video of Keep It Simple Stupid. So today we're going to mix it up. Now I will be discussing vasopressors in a little bit of detail, and it'll be a short series, maybe 2 videos, maybe 3 videos, but this first one is just an introduction to vasopressors. And essentially the goals of this specific video are just going to explain to us basically what is a vasopressor. We're going to cover some of the terminology that's often associated with different medications such as ionotropy and chronotropy. We're going to discuss when you would use a vasopressor specifically for something called shock. And then finally, to wrap up the episode, I will just cover some of the basic adrenergic receptors that different vasopressor medications will act on and what their effects are. And that'll be kind of it for this video. All right, so let's go ahead and get into it. All right, so let's go ahead and answer kind of the biggest question of this short video, and that is, what is a vasopressor? And the most simple definition of what a vasopressor is it is an agent causing venous or arterial constriction. So let me go ahead and write that out. All right, so there you have it. Again, a vasopressor, agent causing venous or arterial constriction. And then that perfectly segues into our next question, which is, when do you use a vasopressor? And the simplest answer is in a state called shock. I just threw some exclamation points on there to get the point across that it's important. And then we'll move into the next level. So what exactly is shock? And the most basic definition is shock is inadequate organ perfusion. And again, this will not be a lecture on shock, but it is important just to remember that there are 4 different types of shock, and I'm going to go ahead and list them out here for you, okay? Just remember the 4 different types of shock are distributive, hypovolemic, cardiogenic, and obstructive. We won't get into the specific details of that. We're just going to stick with vasopressors. But let's go ahead and move into some of the common terminology you will hear when discussing vasopressors. All right, so one of the most common terms you will hear when a discussion is had, whether on the ICU or CCU, related to vasopressors, and you may hear the term chronotropy, and it's, if you're like me, the first time you heard it, you're going to think, I have no idea what that means. But the answer is chronotropy is essentially a medication's effect on the heart rate by acting on the electrical conduction system of the heart. So let me go ahead and write that out for you. All right, so it's a medication affecting heart rate by acting on the electrical system of the heart. And just remember, a medication that is a positive chronotrope will increase heart rate, and a negative chronotrope will decrease heart rate. And I'll write that out just so you can remember. All right, let's go ahead and move on. And now the second term you may hear frequently is ionotropy. Right, and similar to chronotropy, first time I heard this, I'm like, I have no idea what that is. But I'll go ahead and make it a quick explanation. So essentially, it is a medication's effect on the force of contraction of the heart. So let me go ahead and write that out for you. Remember that a positive ionotrope will increase the force of contraction, a negative ionotrope will decrease the force of contraction. And then finally, for the last portion of this lecture, we're just going to very briefly discuss the different kinds of adrenergic receptors that are acted on by vasopressors and their effect. I have them listed out in a pretty simple table here. Now these symbols here, this represents alpha and this represents beta. Okay, now let's go ahead and start with alpha 1. So the important thing you need to know about alpha 1 is that it causes smooth muscle contraction and vasoconstriction. Now let's go ahead and move on to alpha 2. Now alpha 2 activation, a little bit different. So if you think of alpha 1 as kind of cranking things up, alpha 2 kind of slows things down. And alpha 2 activation actually decreases blood pressure and decreases heart rate. Now let's go ahead and move into the betas. So beta 1, this is your big boy. And activating the beta 1, it gives you a positive ionotropic and a positive chronotropic effect. And if we remember, again, chronotropy is an increase, a positive chronotrope will increase your heart rate, and a positive ionotrope will increase the force of contraction. So beta 1's your big boy, all right? So positive activation is going to increase your heart rate, increase your force of contraction. Now let's go ahead and move on to beta 2. Now beta 2 activation increases smooth muscle relaxation. And then last but certainly not least, we have beta 3. Now beta 3 activation increases lipolysis, increases bladder relaxation. We discussed the alpha and beta receptors, but there's also V1, V2, and V3, and this will be important in the next video where we discuss specific vasopressors. But the important thing to know about these is it's a separate mechanism, and we'll discuss a medication called vasopressin, also known as antidiuretic hormone, and it acts on these receptors, and we'll just very quickly discuss what these receptors do. So V1 is on smooth muscle and causes vasoconstriction. V2 you will see in the renal system an activation of V2 actually causes an antidiuretic effect. What that also means, if something's an antidiuretic, it means you're not peeing, so you're retaining volume. And then lastly, V3 is in the anterior pituitary, and activation of V3 increases steroid release, which also results in increased blood pressure. All right, guys, well, that's all I have for you today. So again, the whole point of this video, we were just very quickly discussing what is a vasopressor, what is ionotropy, what is chronotropy, what is it used for, a vasopressor, which is going to be in shock, and then we just went through the basic adrenergic receptors. Guys, I hope this is helpful. That's all I have for you today. And as always, like, comment, subscribe. I'll see you next time.